Welcome back to the Best BT Podcast. This is episode 17, talking about thermal modalities. So some basics about heat modalities. Remember that heat transfer. Heat always moves from areas of high heat to low heat. Conduction is the transfer of heat due to direct contact, such as sitting on that nice cold concrete surface on a hot day. Examples include hot pack, cold pack, paraffin wax, ice massage, and cryocuffs. Convection heating is the transfer of heat due to air or water moving in a constant motion across the body, such as with a convection oven, a fan, or whirlpool. Conversion heat is heating that occurs when non-thermal energy is absorbed by body tissue and then converted into heat energy. This happens with ultrasound and diathermy. Evaporation is the transfer of heat as a liquid, when the liquid absorbs energy and transitions from a liquid to a vapor or gas. This occurs with vapocoolant spray. And finally, radiation. This is the direct transfer of heat from a source of radiation, so this happens with infrared lamps, lasers, and ultraviolet light. Superficial thermotherapy penetrates 2 centimeters max. The purpose is to decrease muscle spasms and tone, increase blood flow, collagen flexibility, metabolic rate, muscle flexibility, nerve conduction velocity, and pain thresholds. Contraindications: acute musculoskeletal trauma, arterial diseases, bleeding, cancers, and vascular disease. Indications: abnormal tone, decreased range of motion, muscle guarding or spasms, trigger points, pain, or inflammation. Hot packs. Transmission of energy occurs by conduction. They should be stored between 158 and 167 degrees Fahrenheit. Application requires 6 to 8 layers of towels between the hot pack and a patient's skin. So a commercial hot pack cover is equivalent to 2 to 3 layers of towels. Maximum tissue temperature is reached in 6 to 8 minutes, with 15 to 20 minutes to achieve the desired therapeutic effect. And remember that hot packs take approximately 30 to 120 minutes to reheat inside a hydro collider after each session. Fluidotherapy. Transmission is by convection. This is a container that circulates warm air and small cellulose particles, a dry heat. This allows higher treatment temperatures than hydrotherapy. Open wounds should be covered inside a fluidotherapy container. The therapeutic temperature is 100 to 118 degrees Fahrenheit. The treatment time is 15 to 20 minutes. And the agitation of the particles inside can be used for pain desensitization. And some units allow patients to perform active exercise of the distal parts of the extremities, so the hands and feet, while inside the unit. Infrared heating. Transmission is by radiation. The wavelength of the light used should be 780 to 1500 nanometers. This enhances soft tissue healing. The lamp should be placed 20 inches from the patient, and protective toweling should be used to cover all non-treatment areas. 15 to 30 minutes treatment duration. Side effects can result in dry skin and non-uniform heating. Paraffin wax. Transmission is by conduction. This allows the most even distribution of heating of all the thermal modalities, especially of the fingers and toes. The wax has a low specific heat, so the patients are able to tolerate heating by paraffin wax better compared to moist heat or dry heat through other methods. Wax should be stored between 113 and 122 degrees Fahrenheit. Paraffin peeled off after treatments and placed back into the container can be melted and reused, which sounds really disgusting. Some machines can heat up to 212 degrees in a sanitation mode to kill bacteria, and the recommended change for wax is once every 6 months, which is also disgusting. 3 different types of wrapping with paraffin wax. A dip wrap, so dip the hand or foot into the wax, remove, wait for the wax to harden, and then repeat 6 to 10 times, so you're just building up a bunch of layers of wax. Then apply a plastic bag or plastic wrap, and then a towel to reduce the cooling. Treatment time is 10 to 15 minutes. Dip reimmersion. Perform the dip wrap method, but instead of pulling it out after 6 to 10 times, Leave the extremity inside the bath for the entire treatment. Treatment time is about 20 minutes. Paint application. So this is for use with body parts that cannot be easily immersed. Paint the paraffin wax on a specific area, 6 to 10 layers, waiting for each layer to harden before applying a new layer, and then wrap with plastic bag or plastic wrap and towel. Treatment time is 20 minutes. That's it for episode 17.1, talking about superficial thermotherapy. The next episode, 17.2, will talk about deep thermotherapy. As always, the outline will be in the show notes. Thanks for joining me.